Hi everyone, welcome to the first BioBulletin episode of the year. Today we're going to be discussing the COVID-19 vaccine and delving deeper into an in-depth conversation about the other vaccines being produced, the new strains of the virus that are just surfacing, and discuss whether this vaccine truly marks the end of our battle with coronavirus or not.
So I'm sure, as you all remember, the start of last year, we were informed about a cluster of cases of pneumonia of an unknown cause, and this was detected in Wuhan, China. And it was subsequently identified that it was a type of coronavirus. So, for those of you who don't know, coronaviruses are a large family of viruses with some causing less severe disease, such as a common cold, and others causing full on respiratory failure. And it is primarily transmitted between people through respiratory tracts, droplet and aerosol, and contact routes. The transmission risk is highest where people are in close proximity, hence, we've been adhering to social distancing guidelines. And the most common symptoms that people are experiencing are fever, a new and continuous cough, shortness of breath, and loss of smell and taste. There's also certain non-specific symptoms.
Sorry, I was actually just gonna ask about what you were just talking about. I was gonna say, aren't there some symptoms that only older people get or the elderly get?
Yeah, so there are some non-specific symptoms, and that means that symptoms that aren't definitely to be coronavirus, but could be, and you should watch out for those. And those are fatigue, sore throat, headache, and nasal congestion. And as you mentioned, with the older public, there are also other symptoms that maybe the younger generation won't experience, such as delirium and reduced mobility. And this can often happen in the absence of fever, so it is quite worrying. So, since the identification of coronavirus last year in January, there have been several different lockdowns that we've been partaken in. And the first lockdown on the 23rd of March 2020 meant that we could only have essential travel or essential work for us to leave our houses and only one exercise session per day. Since then, around June 2020, the restrictions eased and we were allowed to meet 6 people outside from no more than 2 households. The restrictions eased further during September when we were allowed to meet 6 people inside, and restaurants and bars had all opened up again.
Yeah, there was, of course, the second lockdown, though, so from the 5th of November to the 2nd of December. And in that lockdown, we were in a tier 4 style lockdown, meaning we were asked to work from home where possible, stay at home where possible, all non essential goods stores and luxury goods stores were closed. But schools and colleges were kept open, which is an interesting decision. But yeah, that's also worth mentioning. And
Also, in addition to that, obviously during the first March lockdown, which started on the 23rd, as you mentioned, schools obviously closed, and that's when GCSE and A-level exams were cancelled, which led to a bunch of controversy around how grades would be decided and everything, right?
Yes, certainly. And also quickly mentioning, going back to the tier point, so we've in the UK graded all of our lockdowns with tiers since November, and the tiers are numeric from 1 to 5 with increasing severity.
yeah, the tier 5 you mentioned was, of course, or as it turned out, was more speculation because many people believed that as of January 2021, we'd have to go into a further lockdown and that the government would release plans for a tier 5 lockdown. But what ended up happening, of course, as all our listeners will know now, is we got put into a full March style lockdown with school closures, university closures, exam cancellations, us being asked to stay at home, any any secondary shops being closed, and that was obviously due to a huge surge in cases due to this new second strain, which we'll get onto later, and the NHS, as cliche as it is, being on its knees. So cases rose to over 60,000 new cases a day, or very near to it anyway, and deaths rose tremendously too, with very near 1,000 people dying daily, which is above the peak of the March lockdown, of when we went into the March lockdown, which is extraordinary because it means the virus is at its largest point so far.
Okay, so we all need some stats when it comes to analyzing this virus. We always see on the news and people always talking about it. So as of the 27th of December, 2020, the number of coronavirus cases worldwide was 80,794,083. And that doesn't include people who may have had the coronavirus, but they haven't done a test. There have been 1,766,513 deaths and 57,006,973 recoveries. The US have had the highest number of total cases worldwide, not really that shocking, with 19,433,847 cases, and consequently that contributes to the most total deaths, which was their contribution was 339,921. The country with the lowest number of total cases is Vanuatu, a South Pacific Ocean nation. It only had one case, and that one person has also recovered. We always see these like absurd numbers in terms of total case and deaths, and it's quite astonishing to see. But of course, population must be considered, and there's only 300,000 people living on the islands. But what do you think? Like the only one case on that whole nation?
Yeah, that's quite shocking. And it's also interesting to see how like different countries, even with similar populations, have had less or more cases based on how governments have dealt with it, which I found interesting because it shows how the like efficacy of different controlment methods.
Yeah, I mean, in the UK, there's obviously been a lot of debate about how the government is handling the whole spread of coronavirus. In the UK itself, there's been 2,256,000 cases and 70,405 deaths. That was on the 27th of December. The daily new cases across the world have risen like profoundly over the course of last year. At the start of our lockdown, so she's like I said, March 22nd, there was 36,600 daily new cases. We had a peak on April 10th to about 98,169. Then a decline, a steady increase to July 31st, where we saw close to 300,000 new daily cases. And then since October 10th, we've seen the sharpest increase, 736,000 new cases a day, up till 18th of December. And the death rate has increased proportionally to about 13,000 when last recorded 23rd December. Just a little bit quick facts.
Yeah, that's also quite shocking as well with the magnitude of it. I think it's like well illustrated with the stats.
Also, just quickly, those stats you mentioned, I believe they were from December of 2020, as I believe you said. But obviously now the death rate and R number and cases per day have risen tremendously again. Now peaking with, again, I think over 1,000 deaths per day and very near 60,000 cases per day. So yeah, just a quick update on those stats.
Yeah, exactly. And as you all know, it's been a terrible and extremely unexpected thing. The biggest news right now isn't just the stats, it's the new vaccine that's been introduced to all the hospitals around the UK. What do you guys think?
Yeah, so obviously, like you mentioned, the vaccine from Pfizer in conjunction with BioNTech has just been started to be rolled out to certain like vaccination centers and stuff. But Pfizer currently owns all of the details to the completed vaccine, so they're the main company being used to produce it because they're the only ones who can make it, obviously. So it was announced on the 9th of November, I believe, after being found to be 90% effective on testing, which involved over 43,000 volunteers, and no serious health concerns or risks were found, which was obviously very promising. I believe it was an elderly lady named Margaret Keenan, who was aged 91, who received the vaccine first, right, on the 8th of December
Yeah, it was in
of 2020.
Coventry, I think.
Yeah, I think it was, yeah. And she received it at 6:31 in the morning, and she was the first individual in the whole world to receive the vaccine, which is quite amazing. There are now a further 800,000 doses that are scheduled to be given out over the coming weeks of this Pfizer vaccine, with a further 4 million doses being expected to be given out over the coming months, according to the NHS officials and the Health Secretary Matt Hancock. There was, of course, a huge race to find this vaccine, with many organizations getting involved, right?
More than 90 vaccines are being developed against coronavirus by research teams in companies and universities across the world. Researchers are trialing different methods, and some of which haven't been used in a licensed vaccine before. So at least 6 groups have begun injecting formulations into volunteers in safety trials, and others have started testing in animals. So all the vaccines aim to expose the body to an antigen that won't cause disease, but will provoke an immune response that can kill or block the virus if a person becomes infected. And there are at least 8 types being tried against the coronavirus, and they rely on different viruses or viral parts. So at least 7 teams are developing vaccines using the virus itself in a weakened or inactivated form. And many existing vaccines are made this way, such as those against measles and polio, but they require extensive safety testing. And Sinovac Biotech in Beijing has started to test an inactivated version of coronavirus in humans at the moment. Around 25 groups say that they're working on viral vector vaccines, and a virus such as measles or adenovirus is genetically engineered so that it can produce a coronavirus proteins for the body. And these viruses are weakened so they cannot cause disease. And there are 2 types of viral vector vaccines. One of them can still replicate within cells, and those that can't because the key genes have been disabled. So at least 20 teams are aiming to use genetic instructions in the form of DNA or RNA for a coronavirus protein that prompts an immune response. The nucleic acid is inserted into human cells, which then replicates copies of the virus protein. Most of these vaccines encode the virus's spike protein. And many researchers want to inject coronavirus proteins directly into the body. Fragments of proteins or protein shells that mimic the coronavirus's outer coat can also be used.
So, obviously, the Oxford AstraZeneca vaccine has started to be rolled out since the 4th of January, I believe it was. And, that's quite promising, as we discuss later, but it's essentially enabled the government to deliver promises of tens of millions of doses come April, which is a large promise and is still only a promise at this stage, but hopefully one that the government follows through on. And furthermore, Ashish, I just wanted to touch on the stages a vaccine needs to go through. So obviously there's the development and the testing stages prior to further development to produce more batches after we know it's safe. And obviously testing phases enable us to test efficacy, understand how it works with individuals with pre-existing health conditions, whether it affects them, understand how long we may be vaccinated for when we may need another one, the strength of the vaccine. And then, of course, it needs to be checked and verified by a regulatory body in the country of administration, right? So for England, that would be, and the UK, that would be the Medicines and Healthcare Products Regulatory Agency, or the MHRA, along with the Joint Committee on Vaccination and Immunisation, or JCVI. Is that correct?
Yes, so more than 70% of the group's leading vaccine research efforts are from industrial and private firms, and clinical trials start with small safety studies in animals and people, and then this is followed by much larger trials to determine whether a vaccine generates an immune response. And researchers have accelerated these steps and are hoping to have the vaccine ready in 18 months, and they were actually in a shorter time frame of 16. And the most advanced programs feature drugs that have already been tested in humans, and in some cases came to the market prior to the pandemic. In repositioning such drugs for use against COVID-19, organizations skipped the preclinical stage and they entered them quickly for the governments. And I think the main essence of that is certain drugs, you may have heard that, were used for something else, but they didn't work. And then they used the same formula and they transferred it with the coronavirus outbreak. And it turns out that it works well against coronavirus. So there was a lot of preclinical testing and chemical testing that could have been skipped because we already knew that these drugs didn't have an adverse effect on humans, but they only didn't work against the drugs that they were designed for. So I think that's where the race for the vaccine was cut short. What are your opinions on that?
Yeah, so Ashish, an example of what you're talking about would be something like dexamethasone, which is a corticosteroid used in a wide range of conditions for its anti-inflammatory and immunosuppressant effects, right? And obviously it was tested in hospitalized patients with COVID-19 who were critically ill,
and was seen to have huge effects.
Yeah, so animal testing is the most universal method. Another animal test that's been going on is animal substitution. So that's using other animals with similar clinical symptoms to replace the original animal and testing the efficacy of this animal vaccine. I found another method though called serological substitution. So serological testing is basically taking a blood test and analyzing the antibodies that are in your blood. And the serological test for COVID-19 determines the functional neutralizing antibodies and identifies them. And these antibodies bind onto infectious particles and prevent their interaction with host cells, which allows the spread. The new test looks at the neutralizing antibodies that block the spike proteins.
Yeah, I was just going to say,
Yeah.
isn't the spike protein what essentially enables COVID and other similar viruses to penetrate host cells and thus cause infection?
Yes.
And it's like one of the major structural proteins.
Exactly.
The virus, yeah.
And the antibodies just block the spike proteins from binding with the enzymes of the host receptor cells. Yeah. So basically reducing the spread. And this type of testing was how, like all the key terms like herd immunity that was being played around. That's how scientists understood what was going on and how the role of animals in transmitting the virus was understood.
I'm just wondering because often vaccines obviously take a lot longer to actually come out and be used clinically, often between 10 to 15 years in some cases. So what's your guys' opinion on animal challenge trials and human challenge trials? Because obviously human challenge trials have had some negative outcomes before, let's say with like the Elephant Man trials and stuff. And what do you guys think about using this type of testing to get the vaccine out so quickly?
So, from Hindu perspective, I mean, obviously I keep coming back to it, but the doctrine of ahimsa means that non-violence towards animals and all beings. So it would extend towards humans as well. And the Elephant Man trials are a bit. It would be prudent to say risky. It's dangerous. It's borderline dangerous. And also having animal trials that early and an accelerated state is also against Hinduism. I've also talked about the lower forms of how they're the lower forms of consciousness and how we can use animals to survive in a dire situation. But I feel like some of these testing that's being done, they haven't done enough preclinical work for them to actually roll out a testing vaccine. So I think they really need to go back and really work on it first before they just blindly test on animals just because they can at this stage. And there are certain vaccines that are a lot safer, and ones that we use mRNA are a lot safer than using weakened or inactivated forms. I mean, we mentioned about just gonna find the name. It's Beijing Sinovac Biotech in Beijing, and they had a major incident, as you mentioned earlier on in the podcast. And I think that's the sort of thing we really want to avoid. And by putting in the right preclinical work, we can make sure that religious heads are also happy going ahead with the vaccine. So,
Yeah,
that's my opinion on it.
Well, I can talk about just the utilitarian perspective. The public health interventions like the mandatory vaccination campaigns going around right now, they're justified by utilitarianism, specifically rural utilitarianism. So like all these public health policies and interventions, they're justified on the basis that it produces the best results for a larger society. So like Ashish, you said how Hinduism focused on ahimsa, and we touched upon how the vaccine can have negative effects. In essence, it's providing the greatest benefit to the greatest number of people. So utilitarianism backs the use of vaccines, whether it's from the testing on humans and animals. And decisions made on the basis of overall stats and demographic trends are ultimately better for every one of us, even if particular interventions may not directly benefit some of us. So utilitarianism follows the promotion of public health and provides an ethical justification, even though it arguably can infringe upon liberty. I mean, taking a vaccine leaves us in a better position than if we hadn't,
Yeah, of course. I think that was quite well put. But I think it's also important to consider the two other perspectives, which are the medical ethics pillars perspective and a Christian perspective. So on the medical ethics pillars, it's important to consider them, obviously, in a discussion like this. So they are, for anyone who doesn't know, autonomy, which is the right to self-governance, beneficence, which is duty to provide like the best care possible, non-maleficence, so you won't cause active harm, and justice, which is self-explanatory. A human challenge trial obviously does not challenge a patient's autonomy as they're volunteers, meaning it's only given to an individual should they wish to take part in the trial, right? So I'd say it's obviously there's no violation of autonomy there. I'd say it's in support of beneficence because you are attempting to provide the best possible care as a vaccine, especially in a case like COVID, has potential to change the lives hugely, change the lives of people hugely, and save and protect lives, and as we've seen, save millions of lives potentially. Justice is somewhat dependent on the outcome. So, should the vaccine be proved successful and safe, then of course it is just to test and use. But should it have long-term effects, such as in the elephant trials, which I don't know if anyone knows more about, or the Sinovac vaccine, as mentioned earlier, where a patient potentially died, then it's obviously not just. So there is an argument to say it's not just, as I mentioned, but if it goes well, then obviously there's the counter argument. With non-maleficence, it's outcome based as well. So should the outcome prove to have harmed the patient, then the ethical pillar is of course in violation. But should it be a fine and positive outcome, then it's in accordance with the pillar. So I'd say it kind of forces a predicament of sorts because from the medical ethics perspective, it's very much to do with a trial's outcome, and that's difficult because obviously we can never know an outcome of something prior to the trial itself, and we can't judge whether something is fair or not, which leads us to the idea of surely we should do the trial regardless if it's what's best for the world, as you mentioned from the utilitarian perspective, Vivian.
So just moving a little bit away from ethics now, I just wanted to talk about the recent vaccine that's being rolled out and how is it actually delivered? What's like the delivery method?
So I found that there's a kind of like staggered delivery, right? So there's your first vaccination date and then a second one 3 weeks later, but I'm not 100% sure why that is.
Yeah. So they're separate. The Commission on Humans said that it will guarantee the best immunity from the vaccine. They're saying that partial immunity does occur after the first dose. We can see some protection occurring after, I think they said day 12 after the first dose, but the best immunity is 7 days after the second dose. So in essence, the first shot primes the immune response, and the second shot mobilizes the cells again to respond even stronger. So the result being a much better and hopefully prolonged immune response that retains memory. Because the WHO say that the long-lived antibodies and memory cells produced by giving these people the multiple doses, where required means the body is trained to fight the specific disease-causing organism, building up memory of the pathogen so as to rapidly fight it if and when exposed in the future. So we know there's 2 doses, but what's actually in these vaccines? Is it like the flu jab, or they being an attenuated version of COVID, or?
Yeah, so the coronavirus uses spike protein like a key to gain entry into our cells. And once it's inside, it replicates and makes us sick. So what the vaccine does, it breaks that key, essentially. And when the vaccine enters the body, the immune system recognizes the mRNA in it as foreign and begins producing antibodies that target the COVID-19 spike protein. So later, if you're exposed to the coronavirus, the body will already have the antibodies that fight the spike protein on hand, and the virus won't be able to get into your cells or infect you. And that's the other ingredients of the vaccine are pretty straightforward, and they're basically the mRNA wrapped in what you can call a fat bubble, which protects the mRNA when it enters the body. Essentially, that's it.
So the government have announced that they will be delivering, the vaccine in a systematic and staggered approach, right? So the elderly and frontline workers will receive the vaccine first, with the elderly being the most vulnerable to COVID, and frontline workers being the most exposed. And those who live and work in care homes are also eligible for the vaccine now as of Christmas, right? So there's been speculation it will roll out into middle-aged individuals, and then into a lower age bracket and secondary workers who are exposed to people but not at the same level. And it's currently obviously only being delivered at some hospitals, GP surgeries, and specific vaccination centres as well. But with regards to the future, I think one of the most interesting things about this is, do you see it becoming compulsory? There's obviously been speculation about whether you're required to get the vaccine or not. And also, how do you see other vaccines affecting it? So do you think the Oxford vaccine will be used along with others, or do you think Pfizer's will suffice? And yeah, what do you guys think?
So I'll keep it short. And obviously, there are three main vaccines, which is the Oxford, the Pfizer, and I would go as far as to say the Moderna vaccine seems the next most promising one. And the reason I say this is that obviously we've had our problems with the Pfizer vaccine storage, and that's why we can only put it at certain GPs, because minus 70 degrees Celsius is what we need to store the Pfizer vaccine. Sorry, and that can't be found everywhere because that's like a very, 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 very low temperature for any freezer or any deep freezer that we have, and therefore special storage equipment needs to be made. And the Oxford vaccine is the easiest to store, and that's because we have to just store it in 2 to 8 degrees in a normal vaccine fridge in any GP, and you just have to protect it from light. But we also have to see the efficiency of each one, and we've mentioned earlier on that the Moderna vaccine is 94.5% effective, and the Pfizer vaccine is 95% effective. So this is in stark contrast with the Oxford trial, which only proved that it to be 62% effective. So obviously, we have to see the highest efficiency rate is what we need to go for. And the prices, just a little bit about the prices. The Pfizer vaccine is £23 per dose, and the Oxford vaccine is £3 per dose, which is why we have to see in terms of economy, and different countries may have different GDPs. So perhaps some countries will opt for the Oxford vaccine first, and then as their economy restabilizes, then we can go on to Moderna and then Pfizer vaccine. So what's your guys' opinions on that?
Yeah, I was just going to say, you mentioned about the efficacy of the Oxford vaccine. Obviously, the common flu jab is only 45 to 60% efficient at present, which is, it's to kind of put it into like contrast and perspective. But like you said, it is in the trial stages with over 20,000 participants being used. And like you said, it also negates one of the biggest issues. But yeah, generally, I agree. I think it will be used soon. And I think it's quite an interesting prospect, really.
So it is interesting though. Do you see COVID becoming simply something we have to simply live with and vaccinate yearly, like the flu jab, or do you actually see it being eradicated? I mean, what about the second strain? Is that covered by the vaccine?
I think one of the most interesting aspects about it is, will we ever see the back of COVID-19? It's impossible to give like a clear-cut date as to when it will end, and we can only really take from previous pandemics that even this will never be truly accurate, with many prior pandemics originating from influenza strains, and obviously COVID is entirely different. The most deadly pandemic was H1N1 in 1918, which killed 50 million people in 2 years. Um, but that was to do with its contagiousness, and it's difficult because that was obviously, like I mentioned, an influenza-based pandemic. So many other pandemics we've seen still circulate today, even the bubonic plague. They're just simply far more controlled and go relatively unnoticed because medicine and technology has evolved. But personally, I can't see COVID ever going away, so to speak. I just don't think it's realistic. If we looked, like I mentioned earlier, H1N1, that took up until about 1920, 1921 to actually be somewhat eradicated. And even now, it's not truly eradicated. And I just don't think it's realistic to expect COVID to go away fully, even with the vaccine. It will still linger and infect the occasional group, etc. But I think the question of when will the lockdowns, mask wearing, and isolation go, perhaps the end if 2021, and that's what most experts allude to. The vaccine, although in place, needs to spread across significant numbers in order to globally eradicate, so to speak, the hindrances of COVID-19. So I can't really imagine that ending pretty soon, like I said, but of course it will lessen with time. And you mentioned the second strain. One of the biggest issues in this discussion is the new strain of the virus that's arising now, or at the time of recording. And it's currently tearing apart England, with the mutated strain being 70% more infectious than the original COVID-19 strain, right? So it's potentially going to pose real issues. There is a chance that the vaccine provides no actual resistance to the new strain, although the news and Pfizer-based research scientists have said that the vaccine should in fact work on the new strain and may even be more efficient. And news that's just come out recently said that the Oxford vaccine is almost certainly effective on the new strain. But its mutations have occurred on the genetic material that controls the spike protein, which, like we mentioned earlier, enables viruses to penetrate the host cell. And the spike protein, being known more scientifically as peplomer, will only bind to certain host cell receptors. And the mutation occurring in this is what's led to increased contagiousness, which we see in the human. So this could pose huge problems for governments and societies alike. So Patrick Vallance, who's the UK's chief scientific officer, has said that there are 23 changes in the genetic material of the virus, which is an extremely high amount, and it's steroids to potentially make it vaccine resistant. But obviously, like I mentioned, the news is contradicting that now. And there have been many COVID mutations that have spread through mink and other organisms, but none have seen this level of spread in humans, which is, again, why it's so worrying. And further research has also proven that it's more prevalent, it spreads quicker among children of school-going age.
I mean, even looking to present day, we can see the issues it's caused with the second lockdown, which Boris Johnson was adamant he wouldn't do, and a further closing of schools, cancelling of exams. These are all things that have a big impact and have been caused partially due to the second strain. So now, if further strains come, there's talk of still having restrictions in winter. We just can't put a definitive end to it because of these new strains and because of mutations, in my opinion, anyway.
Yes, I agree with Kanishka. Rather than a one-time deal, the COVID vaccine could require booster shots to maintain immunity over time. I agree that you might get it every year or every other year, much like a flu shot. Even if the virus was somehow eliminated from the human population, it could keep circulating in animals and spread to humans again. It likely originated as a bat virus with a still unidentified animal perhaps acting as an intermediate host, which could continue to be a reservoir for the virus. I think the existence of animal reservoirs that can keep reinfecting humans is also why scientists don't speak of the eradication for these viruses. I mean, the Ebola virus, for example, probably comes from bats, even though human-to-human transmission of Ebola eventually ended in the West African pandemic, 2016. The virus was still somewhere on Earth and still infected humans if it found the right hosts. And indeed, in 2018, we saw Ebola broke out again in the Democratic Republic of the Congo. Ebola can be contained through contact tracing, isolation, and new vaccine, but it can't be eradicated. I just want to talk about influenza as well. So the flu is not one virus, but actually several different strains that circulate seasonally. So after pandemics like 2009's H1N1 flu, the swine flu, the pandemic strain does not simply disappear. Instead, it turns into a seasonal flu strain that circulates all year but peaks during the winter. A strain of the 2009 H1N1 pandemic strain is the seasonal flu today. The seasonal peaks never reach pandemic levels because immunity builds in the population. But eventually a new strain that no one has immunity for comes along and starts a new pandemic, and then it becomes the new dominant seasonal strain. So I guess in this way, in the long run, COVID might offer some hope for a return to normal.
Yeah.
I think this virus is with us for the future, but so is influenza. And for the most part, flu doesn't shut down our societies. We just manage it.
I think also you mentioned about how with H1N1 we built up immunity over a long period of time. I think that also links to what Boris Johnson was saying at the start of the first lockdown about herd immunity and that idea. About like how if we all kind of get it, eventually we'll pretty much be immune as a society, and so it will die down. But obviously that's been proven slightly wrong. But yeah.
Okay, so overall, I think that today's podcast has been quite in depth and really good. Thanks a lot, Kanishka, for your talk about the strains. I think that's quite important right now with a lot of people not knowing what's going on, including myself, actually. I don't really understand how there's so many strains and what they do. So overall, I think in terms of vaccines, the vaccine looks like a very promising outcome for us all. And provided that we can get one of the vaccines to be mass produced at a scale large enough to help on the global stage, we can really end coronavirus, or at least partially end coronavirus in many countries that are being affected, both economically and obviously socially as well, in terms of individual people in the countries. So, yeah, I think that's overall. I think that's. See.
Thank you guys for listening to today's podcast. We hope you enjoyed. If you have any comments or any future podcasts you want us to film, please leave in the Google forms below in the description. Please like, share, follow our Instagram and on our newly made Twitter account. And we'll see you next time.
Thanks, guys.